Hi, it's Dr. McCarthy, and today we're going to talk about thyroid treatment success secret number 9. Today we're going to spend a couple of minutes and we're going to talk about anemia. We know already from a previous video I've mentioned that the number one cause of hypothyroidism in this country is an autoimmune condition, Hashimoto's. Some people will ask me, well, what about people who don't have the autoimmune condition? Small percentage of people, but a lot of these things can be mimicked by something that's called anemia. Anemia is basically a problem in the red blood cells. The red blood cells are not able to carry as much oxygen as they can to all the different tissues in your body. One of the things that we'll see is your body, specifically your brain, your nervous system, need two things to function properly. They need fuel and they need activation. The fuel comes in the form of glucose, the food that you're eating, and oxygen from the air that you're breathing. Activation basically means that your body needs to be moving if you want to be stimulating your nervous system properly. Well, you'll have a problem with fuel delivery if you've got an anemia. We've already spoken about lab ranges being far too broad. If you get your lab ranges in a red blood cell analysis or an MC analysis, an MC series, and they're evaluated using the broad lab ranges, lots of times anemias can be missed. And they could say, well, it's subclinical, let's keep an eye on it. I say baloney, let's not keep an eye on it. Why do we want to just sit around and wait for you to get sicker and sicker? Let's run your blood work through the optimal ranges. And if it shows up that you've got an anemia, we need to determine which type of anemia that you have. There's two basic kinds that we deal with on a regular basis. One is B12 deficiency anemia or pernicious anemia, and another one is iron deficiency anemia. Well, if you've got a B12 deficiency, it's real simple to handle. We give you B vitamins, a B complex, maybe with some extra B12. When we do that, it improves the red blood cell's ability to pick up oxygen and carry it where it could go, and we give your brain more fuel. Secondly is an iron deficiency anemia, and there's two different reasons that this can be. One is you're not taking enough iron in, or two can be you're taking enough iron in, but you're just not able to break it down in your stomach. That's probably the more common situation. Most people get enough iron in their diet. There's just not enough acid in their stomach to digest the food, to suck the iron out, to fill up your red blood cells with what it needs, hemoglobin, so that it can carry this. So what we'll do in this case now is we probably won't add in supplemental iron. We'll actually improve the acidic environment in your stomach. If you are not sure if you have an anemia, and if you are still suffering with symptoms and you want to find out, you need to call my office now. Don't suffer another minute. Thanks.